My name is Jago Taylor. I'm a manager at the Health and Social Care Information Centre. The first thing to note is actually NHS is not a single organisation. It's actually quite a complex network of related organisations, but they're very much independent, and that's a really important context.
I'm Jag Dhaliwal. I'm a GP, a doctor in the NHS and also a technology advisor.
In terms of the laws and regulations around privacy, what I think I would say is NHS, quite understandably, is quite a risk-cautious, risk-averse organisation. That's understandable. This is important data, confidential data for patients. So we have regulations called information governance that help us to decide what can and can't be done. Now, what I would say is you don't have to be an expert, but find a woman or a man who is, and you'll have plenty of support here. For example, colleagues at the Health and Social Care Information Centre, often abbreviated to HSCIC, make some connections with them.
IG standards and policies will be set nationally, but how they're interpreted and implemented is very much a local decision. So you've got a very interesting dynamic from the centre setting some policy direction and locally it being interpreted and implemented based on their own views and wishes.
Hi, my name is Martin Severs. I'm the Caldecott Guardian for the Health and Social Care Information Centre. It gives you a easy to read, well written overview of all aspects of information governance in England. The key thing that came out of that report was that we probably weren't sharing enough for the direct care of patients. And a new principle emerged, which was the duty to share can be as important as the duty of confidentiality. That's really important if you're sharing information for the care of yourself or your children or your relatives between doctors and nurses and their teams, because they need that information in order to make sound decisions.
Typically, all NHS organisations will have somebody called a Caldecott Guardian whose job it is to try and work with this. If you can work with them, demonstrate that you really want to take their ideas, their concerns on board, and actually ask them to comment on some of your proposals, they will be your strongest champions. So take the time and effort to make those connections.
The IG Toolkit is the Information Governance Toolkit, and it's a nationally created asset, if you like, that sets out some policies, guidance, standards in relation to information governance. And this toolkit is used both locally within the NHS for organisations to understand and interpret the national guidance around information governance, but equally important for suppliers because they can use it in the same way to assess their products and services and themselves against the national guidance and policies around information governance.
I would suggest any new entrance into the market needs to be concerned with is information standards. Some of the important ones are around standards in terminology. In England that's SNOMED CT, standards in single identity number, which is the NHS number in the health and social care system in England, demographics, and there's a demographic service accessible by the spine, and in order to access the spine you need to go through to a number of tests to be able to connect to the spine.
If, for example, you have a solution such as electronic patient health records, you'll hear people talking about the spine. What on earth is a spine? It's not complicated. Think about it like the spine of the human body. It's just the NHS information health architecture. There's information on it. Take a look, have a read, and people will tell you about it.
I think the spine is an enormous step forward to enable different system suppliers to support direct care.
So we have a system in the NHS for tracking patients based on a unique NHS number. So every patient in the NHS will have a patient number. You might, for example, need this if you're doing some research. You've got some sort of solution, maybe around big data, that might be relevant. Again, there's information available. Just knowing that this exists as a solution may be helpful to you.
Having a unique number across the whole system enables linkage. Now, the NHS number is, on most of the big secondary use data sets, it's about 99% plus in terms of coverage. So you're getting, just with the NHS number, a big step forward in being able to link records in terms of doing analysis for statistical purposes.
So record storage is a complex area. When you think about record storage, you need to think about the storage of the data, offshore, onshore. You need to think access to the data and also retention of data, so how long it's kept and those type of things. Well, smart cards is a form of authentication. And actually, when you think about local systems within the NHS, and we talked a little bit earlier about connectivity to the spine, then user authentication becomes very important. And so the smart card gets loaded with permissions and controls around authentication, so that when you put it into your device or your computer, you know which systems you can access and what data within that system you can access. And smart card is a current mechanism of doing that. In the future, I think we'll see other mechanisms such as mobile devices being used as a smart card, for example.